Good afternoon, Senator Tillis and esteemed members of the committee. My name is Vicki Fischel, and I'm a doctorate of nursing practice student at Old Dominion University and the MDS coordinator for the Geriatrics and Extended Care Service at my facility. We are here today to meet with you to ask for your support for Senate Bill 475, the Alternatives to Pain or Prevent Addiction in the Nation Act. This bill will ensure appropriate access to non-opioid pain management medications for Medicare Part D's already fragile population. This aging population is already dealing with both physical and mental declines, making the task of medication management already challenging, but then adding opioids spawns another problem, addiction. There are alternatives that can be accessed for this population, but they are currently not as openly received or as widely prescribed as opioid medications. By supporting this bill, it will assist with providing appropriate access to safer and healthier non-opioid options for our elderly Medicare Part D patients. My colleagues will be discussing various topics revolving around the Alternatives to Pain Act and the impact that it will have on this population. Their testimony will further reiterate the importance of voting yes for this bill to broaden access to non-opioid medications. Sean Harrigan will be discussing the opioid addiction crisis in the United States. Madeline Hurt will be sharing the social effects of addiction, and then we'll hear from Kate Goolsby on the financial effects of addiction. Then the final testimony will be from Chris Holmes, sharing the advanced practice registered nurse's responsibility in assisting with offering alternatives while providing patients with the best patient-centered practice. With that, we will start
Thank
with
you for the
Sean.
opportunity to speak today on the urgent issue of opioid addiction and the critical need for expanded access to non-opioid pain management. My name is Sean Harrigan, and I'm here to voice strong support for Bill S-475, a bill that will ensure Medicare beneficiaries have appropriate access to non-opioid alternatives under Part D of the Medicare program. The opiate epidemic has devastated families and communities across our nation. According to the CDC, over 80,000 people lost their lives to opioid overdoses in 2021 alone. A significant driver of this crisis has been the over-reliance of prescription opioids for pain management, particularly among older adults who may be at heightened risk for opioid dependence and adverse effects. Despite growing awareness of the dangers of opioids, access to non-opioid treatments remains limited. Many Medicare beneficiaries face significant barriers in obtaining safer alternatives, such as non-opioid analgesics, nerve blocks, physical therapy, and other evidence-based interventions. Meanwhile, opioids remain widely accessible and often present at a lower out-of-pocket cost due to existing Medicare coverage structures. This imbalance creates a dangerous incentive structure that contributes to continued opioid overprescription and ultimately addiction. Bill S-475 is a common sense and necessary step toward addressing this imbalance. By ensuring that non-opiate pain management options are appropriately covered under Medicare Part D, we empower providers and patients to make safer choices without financial constraints pushing them towards opiate-based treatments. This legislation will not only reduce opioid dependence, but also improve patient outcomes and overall public health. I urge this committee to act swiftly in advancing S-475. Every day we delay, more lives are placed at risk. Providing equitable access to non-opioid pain management is not just a policy decision. It is a moral imperative. Thank you for your time and commitment to addressing this crisis.
Hello, my name is Madeline Hurt. I'm a registered nurse and a doctor of nursing practice student at Old Dominion University. Thank you for the opportunity to speak with you today. I want to continue the discussion of the S-475 bill to ensure appropriate access to non-opiate pain management drugs under Part D of the Medicare program. 1 in 3 Medicare recipients receive an opiate prescription, but they are 5 times more likely to end up with the opiate disorder than enrollees in commercial insurance. I would like to discuss the social impacts of opiate use for pain management. Risk factors for problematic opiate use in this population includes pain, comorbidities, concurrent alcohol use disorder, and depression. This increases the risk of misuse, abuse, or dependency. Many social factors increase the risk for opiate disorders in this population. They often live alone, live in poverty, and suffer from disabilities. They face changes in their housing status due to issues with affordability, upkeep, or hazards, bereavement because of the death of loved ones or friends, diminishing physical ability, chronic health issues and diseases, decreased social interaction with others, leading to social isolation from being alone. They change from being employed to retired, leading to lower income. They often lose their social roles. They begin parenting to empty nesters, which is a new phase without the constant presence of their children. They assume roles of parenting as grandparents. These are just a few of the social issues that support the need for non opiate pain management for Medicare recipients to decrease the risk of misuse, abuse, or dependency. Thank you for your time and your support of Bill S475.
Hello, my name is Kate Goolsby. I'm a registered nurse and family nurse practitioner student. I currently work in an area that serves a large Medicare population, and I am here to ask for your support for Bill S475, Alternatives to Pain Act. This bill helps expand seniors' access to safe, effective, and non addictive pain management treatments and decreases reliance on opioids and reduces the risk of addiction. A national survey completed from 2016 to 2017 from the Substance Abuse and Mental Health Services Administration showed opioid use disorder and overdose is a major financial burden in the United States, costing more than $1 billion annually. That's about 0.33% of our GDP. The release of the Council of Economic Advisors White House report on the opioid crisis reveals that previous assessments of the crisis's economic impact significantly underestimated its cost by neglecting the productivity losses from drug overdose deaths. After accounting for these losses, the annual cost of the opioid crisis surged by nearly 600%, reaching $504 billion, an amount that exceeds 2% of the nation's gross domestic product. While the opioid crisis's severity, along with its social and health impacts, including loss of life, already provide a compelling reason to support Bill S 475, the economic cost offers an additional strong incentive to act in favor of this bill.
Today, I want to highlight an important piece of legislation that directly impacts nurses, advanced practice registered nurses, and the future of pain management, the Alternatives to Pain Act that has been presented to the 119th Congress. As nurses and APRNs, we stand on the front lines of patient care. We see firsthand the devastating effects of opioid dependence and the challenges patients face when trying to access safer, non-opioid pain management options. This bill is a critical step toward change. The Alternatives to Pain Act is designed to improve access to non-opioid pain medications under Medicare Part D. It first helps by eliminating cost barriers. It removes deductibles and lowers copays, making non-opioid treatments more affordable for patients. It also simplifies the process. It cuts through red tape by banning step therapy and prior authorization so patients can receive pain relief without unnecessary delays. Empowering healthcare providers, it gives APRNs and other medical professionals the ability to prescribe non-opioid pain management options more easily, ensuring safer and more effective care. The bill is a major step in reducing opioid reliance and improving patient-centered pain management. For nurses and APRNs, this means more autonomy, fewer restrictions, and the ability to provide patient-centered, opioid-free pain management in both the acute and chronic care setting. It allows us to focus on holistic, multidisciplinary approaches that align with the best practice in pain relief, from physical therapy to pharmacological interventions that don't contribute to the opioid crisis. As advocates for our patients, we must support and promote policies like this, ones that prioritize prevention over addiction and place patient safety at the center of care. Let's work together to ensure nurses, APRNs, and our patients have access to the tools we need for safe, effective pain management, because the future of healthcare depends on it. Thank you.
After hearing the testimony from our group, We hope that it provides you with further understanding of the issues around opioids and the importance of providing alternatives to prevent and fight addiction in this population. Thank you for taking the time to listen, and we hope that you please support Senate Bill 475. Thank you and have a great day.